Harold had been taking his B12 every morning for 2 years, never missed a day, never stopped hoping the burning in his feet would finally quiet down. But every night, the moment his feet touched the sheets, the heat and tingling started again. What nobody had ever told him was that the specific form of B12 on that bottle may have been the reason nothing was changing. That supplement he trusted most was possibly the one working least for his nerves. Not all B12 reaches nerve tissue equally, and in adults over 60, that difference may determine whether your nerves are getting any real support at all. If you have been faithful about your supplements and still wake up to burning or numbness, you were never failed by effort. You were simply never given the one piece of information that changes everything. My name is Dr. James. For over 25 years, I have specialized in peripheral neuropathy and nerve damage in adults, the exact conditions behind the burning, the numbness, and the sleepless nights. In the next few minutes, I will walk you through 5 supplement corrections you can act on starting tonight. And before this video ends, I will answer the one question most patients are afraid to ask: whether nerves that have been struggling this long can still respond at all. The B12 supplement sitting in your cabinet right now may carry a label you have never examined closely enough, and that single unexamined detail may explain everything. Most seniors taking B12 for peripheral neuropathy are taking a form called cyanocobalamin. It is the most common form on pharmacy shelves. It is inexpensive, widely available, and recommended without hesitation. It is also a form the aging body must convert before nerve tissue can use it, and that conversion step is the problem. The conversion happens in the liver, and research suggests that in adults over 60, the efficiency of that process declines significantly. So the supplement is in your bloodstream. The active compound your nerves actually need may not be arriving in any meaningful amount. An electrical wire without its insulation coating does not carry a signal properly. The current leaks, distorts, fails to arrive. Your peripheral nerves have a protective coating called the myelin sheath. It surrounds each nerve fiber the way that insulation surrounds a wire, and it is what allows signals to travel from your spine to your feet without distortion or interruption. B12, specifically the active form of B12, is one of the primary nutritional inputs required to maintain and rebuild that sheath. When the form you are taking never fully converts, the myelin does not get the material it needs. The wire stays exposed. The burning continues. In over 25 years of treating peripheral neuropathy, I have seen this pattern more times than I can count. A patient maintaining a disciplined supplement routine for a year or more, the nerve pain unchanged, the assumption being that the supplements simply do not work for them. What was actually happening in case after case was a form problem, not a discipline problem. Not a hopeless case. A form printed in small text on a label nobody ever told them to check. That moment, the one where a patient realizes the effort was real but the information was incomplete, is one of the most important moments in neuropathy care. And it is coming for your nerve health right now. What comes next are 5 specific supplement corrections that research suggests may meaningfully support nerve repair and neuropathy symptom management in seniors. Your pharmacist had access to this information. Most of them never shared it. The single most important word difference in peripheral neuropathy supplementation is not a dosage number or a frequency instruction. It is the difference between 2 forms of B12 that look nearly identical on a label and perform completely differently inside an aging nervous system. Methylcobalamin is the neurologically active form of vitamin B12. Unlike cyanocobalamin, it does not require liver conversion before nerve tissue can use it. It enters the bloodstream and crosses into peripheral nerve tissue and the central nervous system in a form the myelin sheath can immediately use for repair and maintenance. Research published in the Journal of Neurological Science and supported by international bioavailability studies in adults over 60 suggests that methylcobalamin may support axonal regeneration, the process by which damaged nerve fibers attempt to repair themselves, in ways that cyanocobalamin, even at equivalent doses, cannot reliably replicate in the aging body. These findings are directional and qualified, not absolute. but the biological mechanism is specific and documented. Before changing your current B12 supplement, bring this specific question to your doctor. Which form is appropriate for your situation, and what amount makes sense given your overall health picture? That conversation starts with the word methylcobalamin. Methylcobalamin is the first correction. It is not, however, sufficient on its own, and the reason why leads directly to the second. Peripheral nerves living under chronic oxidative stress do not repair efficiently regardless of what building material is available to them. And if your neuropathy is connected to blood sugar irregularities, aging, or both, oxidative stress along your nerve pathways is almost certainly part of the picture. Alpha-lipoic acid is an antioxidant with one structural property that makes it uniquely relevant to nerve health. Most antioxidants are either fat-soluble or water-soluble, meaning they can reach certain tissues, but not others. Alpha-lipoic acid is both. That dual solubility allows it to penetrate nerve cell membranes and act directly on the oxidative environment surrounding peripheral nerve fibers. Research from European clinical trials studying diabetic peripheral neuropathy has found that alpha-lipoic acid may reduce the oxidative stress interfering with nerve signal transmission and may support the cellular conditions in which nerve repair becomes more possible. These findings are qualified and directional, but the mechanism is specific to the tissue that matters most for people managing burning feet and nighttime nerve pain. Before adding alpha-lipoic acid to your current supplement routine, discuss it specifically with your doctor. It may interact with blood sugar medications and thyroid medications, and the appropriate form and amount depend entirely on your individual health situation. If you are currently taking supplements for neuropathy or nerve pain, I would genuinely like to know your experience. Drop a comment below sharing which supplements you are on and how long you have been taking them. Not a yes or no. Your actual experience. What improved? What did not? How long you waited? That kind of information matters in this conversation. The combination of the first two corrections is where the research becomes harder to dismiss, and where the science begins to explain something most people managing neuropathy symptoms have never been told. Nerve repair is not a single input event. It requires both the right structural material and the right cellular environment in which that material can be used. Methylcobalamin provides the neurological building material for myelin synthesis. Alpha-lipoic acid reduces the oxidative interference that prevents that synthesis from proceeding efficiently. Separately, each has documented directional support in neuropathy research. Together, research from diabetes and neuropathy clinical studies suggests the combination may produce symptom outcomes that neither compound achieves reliably on its own, specifically in peripheral neuropathy associated with aging and blood sugar dysregulation. Walter was 69 years old and had been taking cyanocobalamin B12 every single day for 3 years. He had type 2 diabetes, burning feet every night, and sleep that had been interrupted for so long he had stopped expecting anything different. His care team told him his neuropathy was progressing and that this was expected at his stage. Under his doctor's guidance, he switched to methylcobalamin and added alpha-lipoic acid. Within several weeks, he reported a measurable reduction in the nighttime burning, and then his first full night of sleep in over a year. Not a reversal, not a cure, a specific, measurable shift that his previous supplement routine had never produced. The answer to the question planted at the beginning of this video, which form of B12 actually reaches nerve tissue, is methylcobalamin. That is the biological answer. And if the bottle on your counter says cyanocobalamin, you may have been one label away from a different outcome for longer than you realize. Your nerve health right now depends not just on effort, but on specificity. And the next two corrections address angles most neuropathy conversations never even reach. Before adding any combination to your routine, bring it to your doctor first, especially if you are managing diabetes, as alpha-lipoic acid may affect blood sugar regulation in ways that require monitoring. There is a form of vitamin B1 that almost nobody managing neuropathy symptoms is ever told to look for, and the reason it matters comes down to a basic problem of entry. Standard thiamine, vitamin B1, is water-soluble. That means it dissolves in water, travels through the bloodstream, and struggles to penetrate the fatty membranes surrounding nerve cells. Benfotiamine is the fat-soluble form of the same vitamin. That structural difference is not a minor variation. Research suggests that benfotiamine reaches peripheral nerve tissue at significantly higher concentrations than standard thiamine can achieve, and that once inside the nerve cell, it may support the metabolic pathways involved in protecting nerve fibers from glucose-related damage. Specifically, studies from European and Asian neurology journals indicate that benfotiamine may help reduce advanced glycation end products, compounds formed when excess blood sugar binds to proteins and damages the surrounding tissue, including nerve fibers. In seniors managing blood sugar irregularities, this mechanism is directly relevant to the progression of peripheral neuropathy symptoms. I want to stop here for a moment because one patient comes to mind every time I discuss this. He had been in my care for several years, managing worsening neuropathy, and at one point he told me he had stopped believing any supplement change could make a meaningful difference. He had tried too many things, waited too many times, and arrived at a place of quiet resignation about his nerve pain. When we corrected his supplement forms and added benfotiamine to his protocol, his report at the follow-up several weeks later was not dramatic, but it was real. He described it as the first time in years that his feet felt less like they were being held over a heat source at night. That conversation is why the specificity of form matters as much as the intention behind taking the supplement. Before adding benfotiamine, bring it directly to your doctor, particularly if you are currently on diabetes medication, as it may interact with blood sugar management and requires proper coordination with your existing care. The fifth correction involves a mineral, not a vitamin, and it may already be depleted in your body because of a medication you take every day. Metformin is one of the most commonly prescribed medications for type 2 diabetes. Research has established a consistent association between long-term metformin use and reduced magnesium levels in the body. The same pattern has been observed with certain blood pressure medications. Magnesium is not a peripheral nutrient in the context of nerve health. It is directly involved in over 300 enzymatic processes, including those that govern how electrical signals travel along peripheral nerve fibers and how the body regulates inflammatory responses in nerve tissue. Research from nutrition and neurology studies suggests that magnesium deficiency in seniors may amplify the perception of neuropathy symptoms, including burning and tingling, not because the deficiency is the root cause, but because it removes a protective buffer that nerve tissue depends on. Correcting that deficiency may support your nerve health right now in ways that are measurable within weeks of supplementation. Before adding magnesium, speak with your doctor. It can interact with medications for heart rhythm conditions and kidney conditions, and the appropriate form and amount vary significantly by individual. 5 corrections now exist where before there were none, and the most common response to information like this deserves an honest, direct answer before this video continues. If you have tried supplements for your neuropathy before and nothing worked, that response is not irrational. It is earned. You spent real money. You maintained real discipline. You waited for results that never arrived. That experience does not make you a poor candidate for improvement. It makes you someone who was given incomplete information and told to simply be consistent with it. The form of B12 you were taking required a conversion step that your aging body was likely not completing efficiently. The antioxidant environment your peripheral nerves needed was never addressed. The specific fat-soluble forms that can actually penetrate nerve cell membranes were never mentioned. These are not small variables. Nerve repair is a slow biological process that requires precise inputs, not just any B12, not just any antioxidant, not just any duration of effort. Consistency applied to the wrong form produces the same result every time. The effort was never the problem. In my clinical experience, the patients who respond most meaningfully to nutritional correction are not always the ones with the mildest nerve damage. They are frequently the ones who had the discipline all along, but were never handed the specific information that made the discipline matter. What comes next is 3 actions, and the first one starts tonight, before you spend a single dollar. You arrived at this video with a supplement routine that may have been working against your nerve health without your knowledge. You are leaving with specific information that most pharmacists never volunteer during a standard supplement recommendation. First, tonight, before anything else, check the label of your current B12 supplement. Find the ingredient name. If it reads cyanocobalamin, you now know exactly what that means and why the conversation with your doctor needs to happen. If it reads methylcobalamin, you are already on the right form and the focus shifts to what you are combining it with. This single label check requires no prescription, no appointment, no expense. It may also be the most directly useful thing you have done for your nerve health in years. Second, tomorrow, look up whether alpha-lipoic acid is available at your local pharmacy. Write down the name. Bring it to your next doctor's appointment alongside the question about methylcobalamin. Ask specifically about the form and amount appropriate for your individual situation. You are not asking your doctor to follow a YouTube recommendation. You are arriving at that appointment with specific, informed questions, which is the most productive version of that conversation. Third, choose one symptom: the burning, the tingling, the numbness. Pick the one that disrupts your daily life most directly and track it for 4 weeks following any supplement form change. Measurable progress requires a measurable starting point. Without that baseline, improvement can happen and go unrecognized, which is one of the reasons people conclude nothing is working when something actually is. One thing worth naming directly: checking that label tonight costs nothing and changes everything about how informed that next conversation with your doctor can be. That is not a minor shift. For your nerve health right now, it is the difference between hoping and knowing what to ask. Everything covered in this video can now be brought together into the clearest picture of what peripheral neuropathy nutritional support actually requires. And it is more specific than anything most care teams ever communicate to the people who need it most. The first correction is methylcobalamin, the neurologically active form of B12 that reaches peripheral nerve tissue without requiring the conversion step that aging bodies increasingly fail to complete. The second is alpha-lipoic acid, the dual solubility antioxidant that research suggests may reduce the oxidative stress interfering with nerve repair along peripheral pathways. The third is the combination of both, because the research suggests that the right building material and the right cellular environment, used together, may produce outcomes that neither produces reliably on its own. The fourth is benfotiamine, the fat-soluble form of vitamin B1 that penetrates nerve cell membranes where standard thiamine cannot, and that research suggests may help protect nerve fibers from glucose-related deterioration. The fifth is magnesium, the mineral most commonly depleted by diabetes and blood pressure medications, directly involved in nerve signal transmission and the body's inflammatory response in peripheral nerve tissue. If you are watching this and you currently take B12 for your nerve pain, I would like to know which form is on your label, and whether this information changes how you plan to approach that next conversation with your doctor. Share it in the comments. Not a simple yes or no. Your actual situation, what you have been taking, and what you are now thinking about changing. That kind of specific exchange is worth more in this community than a quick reaction ever will be. If someone in your life mentions burning feet, tingling that wakes them at night, or nerve pain they have been managing with a standard B12 recommendation, send this video to them. Not because it has all the answers, because nobody ever told them which form to look for, and that detail is on a label they already own. In the next video on this channel, we are going to cover the 3 foods that research suggests actively interfere with nerve health in adults over 60, the specific dietary patterns that may be accelerating the very damage the right supplements are trying to address. If you have not yet subscribed, now is the practical moment to do so. Living with peripheral nerve pain while unknowingly taking a supplement form your body cannot efficiently use is one of the most correctable situations in senior nutritional health. You now have the specific language to walk into your next appointment with real questions. And that is a genuinely different position than the one you were in before this video. And to the second question raised at the beginning, whether nerves that have been struggling this long can still respond. The honest, qualified answer is this. Research suggests that peripheral nerves retain a meaningful capacity for repair and adaptation further into the progression than most patients are ever told. The right nutritional support, in the right form and combination, may help slow further deterioration and support symptom management in ways that are real and specific. That is not a guarantee. It is not a cure claim. It is what the evidence currently supports, and it is more than most people managing neuropathy symptoms have ever been told.